Subscribe now for easy-to-understand health tips. Dr. Madam.
Just imagine, suddenly a pressure inside your head. Sometimes it's throbbing, sometimes it feels heavy, and that's when the question arises, is this just a headache or is there a bigger reason behind it? Today we'll try to understand in simple terms, what is a headache, how many types of headaches are there, which ones are common, and which ones need a bit more attention. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK and other reliable medical sources. Before we start the video, please subscribe to this channel. Stay with us for science-based, doctor-reviewed health videos explained in simple language. What is a headache? Pain or throbbing inside the head or face. Almost everyone experiences a headache at some point in their life. There's nothing to be afraid of. Most headaches are not caused by any serious problem. The two most common types of headaches are tension headaches and migraines. However, many people start to worry if the pain feels very different, becomes very severe, or starts happening more frequently than before. The biggest fear is whether this could be a sign of a brain tumor. In reality, this is very rare. Types of headaches. Headaches are generally of two types: primary headaches and secondary headaches. A primary headache is a problem in itself, while a secondary headache occurs due to some other illness or injury. Now, let's break it down simply. Tension headache is the most common type of headache. It feels like a band of pressure around the front or sides of the head. It can last for a day or two or even several days. The pain is annoying and exhausting, but it usually doesn't wake you up from sleep. Many people are able to continue working despite this headache. The pain tends to get worse at the end of the day, but usually doesn't increase with walking or physical activity. However, you might feel a bit uncomfortable with bright lights or loud sounds. Migraine is also very common. Usually it occurs on one side of the head, with a throbbing pain above or behind the eye. Many people feel nauseous when they have a migraine, and they cannot tolerate light or sound at all. The pain can be so intense that lying down is the only option. If you have one-sided pain, throbbing sensation, and nausea, these three symptoms together make it more likely to be a migraine. Cluster headache is a very severe type of headache. Many people describe it as the most excruciating pain of their lives. Attacks come one after another, sometimes every hour. It can occur daily for several weeks in a row and then not happen again for months. It is usually seen more in adult men, especially those who smoke. The pain is on one side, the eye becomes red, and tears may flow. The nose may become blocked or runny, and the eyelid can droop. Chronic tension headache is a type of headache that persists for a long time. It often starts from tension in the neck muscles. Sitting in the wrong posture for extended periods or spending hours in front of a computer can worsen this problem. It is seen a bit more frequently in women. If you have a headache almost every day for 3 months or more, it is called chronic daily headache. Medication overuse headache is also very important. Many people take painkillers repeatedly for headaches, but if you take them regularly for a long time, the headache actually gets worse. This is called medication overuse headache. In this condition, people take even more painkillers, but they no longer work. This headache can get better, but you have to gradually stop taking painkillers. Thunderclap headache is a type of headache that starts suddenly and reaches its peak within a minute. It's extremely severe and frightening. If you experience this kind of headache, you should not ignore it. It can be something serious. The cause behind it could be exertional and sexual headaches. Some people get headaches during running, heavy work, or sex. Especially during orgasm, a sudden intense headache can occur. Even though it can be scary, most of the time it's not dangerous. However, if it happens repeatedly, it's best to consult a doctor. Primary stabbing headache is a headache that lasts for a very short time. It's a sudden stabbing pain, like being pricked by a needle, lasting 5 to 30 seconds, usually around the ear or eye. This is more commonly seen in people who have migraines. Hemicrania continua is a chronic headache that affects one side of the head and is always present. Sometimes the pain intensifies, and symptoms like watery eyes, nasal congestion, and sensitivity to light can occur. This type of headache responds very well to one particular medication, indomethacin. Trigeminal neuralgia is a facial pain that feels like an electric shock, lasting for a few seconds and affecting areas such as the eyes, jaw, and lips. It can be triggered even by a light touch or a breeze and is more commonly seen after the age of 50. Many people think that headaches always mean hypertension or a serious disease. In reality, hypertension usually does not cause any symptoms. There are many other reasons behind headaches, such as drinking too little water, suddenly reducing alcohol or caffeine intake, exposure to carbon monoxide, or pain in the teeth, ears, or neck can also lead to headaches. Sinusitis and headache. When there is an infection in the sinuses, pain occurs in the front of the head and face. The nose feels blocked, and the pain increases when you bend over. Pressing under the eyes also causes pain. Acute glaucoma can start from a cold or allergy. Suddenly, the pressure inside the eye increases, causing severe pain behind the eye and redness. This is a very urgent condition. How to get rid of a headache? There isn't a single solution for all headaches. You need to figure out what works for you. Drink plenty of water, reduce alcohol, get good sleep, limit screen time before bed, and for some people, a little caffeine helps. Apply a cold compress to your eyes or head, take a warm shower, and stay in a dark, quiet room. Learn relaxation techniques. Breathe slowly, stretch, and try massage, yoga, or acupuncture. These help some people. If needed, you can take painkillers like paracetamol, ibuprofen, or aspirin. How to stop a headache fast? Rest, drink water, stay calm, and if necessary, take paracetamol or ibuprofen. Do gentle neck stretches. And if the headache suddenly becomes very severe or keeps getting worse, consult a doctor. Final thought. Headaches are very common, but not all headaches are the same. Understand your body, observe the patterns, and with proper care, most headaches can be managed. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK. Basin Specialist, Diabetes and Hormone Specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other reliable medical sources. If you found this video helpful, please subscribe and share, because good health begins with awareness.